Welcome everybody to this exciting day. It feels like Christmas in May, if you ask me. So try to keep it as short as we can. I want to say special thanks to Clay County Commissioners and other city and county officials who are attending. Also want to thank our community partners, healthcare and other agency officials, Gertz Construction, Klein McCarthy, residents and visitors. Today is a very special day for our region. With this new facility, we will be able to respond to the increasing demand for substance use disorders. And with that, I will turn over to our first speaker, Kathy McKay, the Public Health Administrator.
Thank you. I will just provide just a little brief, 2 minutes I've been told, history of Detox. So initially our county Detox program began around 1973. In the fall of that, it was in the jail. It was only 3 to 4 beds at that time. And then 20 years later, we moved it to the Family Service Center, which it is there today. We had a license for 10 beds in 1994, and then 1995 we had 16 beds, and today we still have 16 beds in that Family Service Center. We've certainly seen the increased demand and need expansion, and have needed that for quite a long time. It's not a very good placement in the Family Service Center building anymore. So this new building will help us increase our capacity up to 32 beds. So we're excited about that. We have 2 licenses through the Department of Health and the Department of Human Services. One is for Detox, and then we were fortunate enough to have an additional license just recently, and that is for withdrawal management. So we technically have both of those programs. Withdrawal management, we're able to bill Minnesota medical assistance, so there's revenue attached to that. We're required to have certain staff on position, and it has to be registered nurses, LPNs, technicians. We have a licensed addiction counselor, and we have a peer support specialist. We also contract with the medical director, both for both programs, the Detox and the withdrawal management. Clients that we accept are 18 and older. We don't have any youth that we can have in this program. They stay up to about 72 hours, and it can be longer with the withdrawal management program. They have to be stabilized when we discharge them. They meet with the nurse. They also meet with the LADC, who facilitates a discharge plan and hope to refer to services and other treatment programs as they need be. So we're grateful for this opportunity. We look forward to the expansion. It's been a need for a long time in our communities, so we hope to meet that in a much better way by having larger capacity. Thank you.
Thank you, Kathy. Our next speaker is Commissioner Mojo. She's been on our building committee since the very beginning, so thank you, Jenny.
Thank you so much, Troy. Sorry, pulling up my notes. All right, thank you all of you for joining us today as we gather here for the groundbreaking ceremony of our Clay County Withdrawal Management Facility. This project has been in the works since November of 2021, when Clay County was fortunate enough to receive a grant award in the amount of $5 million from the Department of Human Services. This initial funding provided the foundation for what has become a collaborative effort to address the needs of our community. Today we mark the beginning of an essential endeavor that will have a profound impact on our community. The creation of this facility has been a collaborative effort with the hard work and dedication of numerous individuals and organizations coming together to make it a reality. I would like to express my gratitude to all of our stakeholders, especially staff, my fellow commissioners, healthcare professionals, addiction specialists, and community advocates who have been instrumental in bringing us to this point. In conjunction with the grant, we engaged the services of Klein McCarthy Architects to design the building, ensuring that it would meet the unique requirements of our community. We established an internal building committee to oversee the project and make informed decisions throughout this process. Multiple design meetings have been had, allowing us to refine the vision and create a space that will serve our community well into the future. To further support this endeavor, we were pleased to secure additional funding from our Clay County ARPA committee and opioid settlement funds without the need for additional taxpayer dollars. Clay County has recognized the urgent need for a comprehensive approach to address the issues of substance abuse and addiction in our community and our region. We understand the devastating impact these challenges have on individuals, families, and the overall fabric of our society. Today, we take a significant step forward in tackling this crisis head-on. The Clay County Withdrawal Management Facility will serve as a beacon of hope for those who are battling addiction. It will provide a safe and supportive environment for individuals in the initial stages of recovery, offering a wide range of services to assist them throughout their withdrawal process. This facility will provide resources to help individuals regain control of their lives. Moreover, this facility will not operate in isolation. It will be an integral part of a comprehensive continuum of care. By fostering strong partnerships, we aim to provide a seamless transition for individuals from the withdrawal management facility to possible ongoing treatment and support services. Today, we send a clear message to our community. Clay County stands united in its commitment to addressing the challenges of addiction. We refuse to let this stigma or despair define us. Instead, we choose compassion, understanding, and resilience. This facility represents a crucial investment in the health and well-being of our community, and it is a testament to our collective determination to build a brighter future. As we break ground today, let us remember the countless lives that will be positively impacted by this facility. Let us recognize that recovery is possible and that every individual deserves an opportunity to heal and rebuild their lives. Together, we can create a healthier Clay County. Thank you for your unwavering support, and I look forward to celebrating the completion with all of you of this vital facility in the fall of 2024.
Thank you very much, Jenny. Our next speaker is Sherm Severson. He is the Executive Director at Sanford Health.
Thanks, Troy. Thanks, Kathy. This is an exciting day overall. I've been, working in EMS specifically for about 30 years in this community, and I can tell you that in 1994, 10 beds wasn't enough. And, I even, hearing that we're going to 32 is exciting. I think we're going to fill them. I'm hoping we can. Staffing problems are an issue everywhere, and I'm nervous about that, but at the same time, it's really exciting to be here, to be part of this. So thank you for that. Couple of remarks I want to share with you folks. I really do appreciate this opportunity. This new facility means a great deal, probably more than most of us recognize, certainly to Clay County and our surrounding region, really. I mentioned earlier I've been involved in EMS for 30 years. That's about the same amount of time I've lived here in Clay County. I'm a resident of Moorhead. So I feel personally connected to this project and certainly the work that all of these folks do. My role at Sanford Health, I've had privilege of leading many teams in multiple areas that will be and have been directly impacted by this facility, Clay County Withdrawal Management and Detox. What I have seen is the wake effect that substance use and abuse has on not just the individual, but our community. It impacts a person's job, it impacts their family, it impacts that wake impacts so many people beyond the actual person suffering from an addiction or substance use disorder. So this is needed. It's absolutely needed, and the timing is really perfect. This will impact people positively. This is a value add to our community. Sanford Ambulance to focus on that a little bit. That's the part of my job I know most. We are responding now to, over the last 3 years, the average has been about 10 calls per day for a substance use problem related call. So that's a pretty significant number of calls if you think about it, 10 a day. Now, all of those don't end up going to detox, of course. Many go to the ERs, but the reason we need this facility is it will be providing the right level of care to the right type of patient at the right time. If we send them all to the ER, which is really what was happening pre-1994, if they're all going to the ER, we're filling up beds that may not be the type of acuity we need in an ER. Sanford's a level 1 trauma center, for example. We take patients from all over the region. We're looking at life-threatening illness and trauma. When we have a patient that's experiencing withdrawal, that can also be life-threatening, but it requires a different level of care. It requires time. It requires somebody who's specifically trained to deal with that patient. That's what this facility will do. So I guess just in closing, just make no mistake about it. The Clay County Withdrawal Management and Detox Facility is and will continue to be a value add to our communities and the surrounding communities. We know that no child sets out their life with the goal of becoming an addiction or having an addiction. We don't want family members sitting up all night worrying about their safety when somebody is experiencing this type of issue. This building represents a new kind of era, a new hope for these patients, new hope for families. It will provide stability, help people reclaim their life if they're having a struggle with addiction. And I love that Clay County's taken this head on rather than, pretending it isn't a problem to deal with. As I stated earlier, I'm a proud resident of Clay County, and on behalf of others that share that title, I congratulate and thank Troy, Kathy, commissioners, this county, everyone really who plays a role in the treatment of these folks, helping them, again, reclaim their lives. This new facility will be the home to important work, and I wish for it, and those delivering the care within it, complete success. Thank you.
Thank you, Sherm. As the director of this facility, I see things from the patient level on up, and the amount of support that we've had for this building from law enforcement, Clay County administration, and our commissioners has been, you couldn't ask for anything more. Our community support and what we're going to be able to do, like Sherm said, is truly going to be amazing. So I want to thank everyone for attending this event, and hopefully we look forward to the ribbon cutting and being able to help even more individuals, beat their substance use disorder. So thank you.